Hi, I'm Dr. Jonathan Clark. In this brief video, we're going to try and explain to you why we're so successful with treating people that have chronic disc problems and helping them avoid spinal surgery, be it neck or back surgery. So we see a whole host of complaints. You may have been diagnosed with degenerative disc disease, a herniated disc, spinal stenosis, or sciatica, some form of radiculopathy. What I find very troublesome when patients come in my office is they often don't even know what some of these things are, number one, or number two, what this really looks like other than what their doctor has told them. So let's give a brief anatomy lesson here so you can see what it is we're dealing with here. So what we have here in this is an actual normal spinal vertebra, which is these two areas right here. Then we have a normal spinal disc. So as our spinal cord comes down here, branching off the spinal cord, you have these spinal nerves which go to different areas in our body. If this is in the neck, it goes into the neck and shoulders, into the hands and fingers. If this is the low back, obviously it goes down the low back, controlling the leg muscles and the toes. So we may have a degenerative disc disease where things start to break down, or a herniated disc where that disc now becomes squished and we have a bulging coming out from the side, which can interfere with that nerve and where it goes. When you feel that pinched nerve pain feeling, that's what's going on. We can have central canal stenosis or foraminal stenosis. Stenosis simply means narrowing of the area. So there can be narrowing of the cord area due to disc compression, pressure backwards, or there can be narrowing of the cord narrowing of the foramen, the hole where this nerve exits from the disc as well. So there's different types of disorders, and as these conditions progress, the disc can deteriorate even more and ultimately start to develop bone spurs or arthritic formations on the vertebra itself. So that's in a nutshell what we're looking at as far as the problems in the joint. But the question is, what do we do about that? And your options up till now have really been very few. It's physical therapy, which for many patients can exacerbate the problem because the area is all very inflamed already. So for us to go in there and move it more isn't necessarily always the best course of action. We can do pain injections or could become put on some mind-numbing medications. And we know from research now that pain injections are basically a very, very expensive Band-Aid. This is what the literature is telling us now. It doesn't really do anything to help with long-term improvement. Surgery is an option as well. And we know that half of spinal surgeries can come to a failure to actually fail to relieve your symptoms. So, and I'm sure all of us know the person that's had one surgery, two surgeries, three surgeries, and sometimes they're even worse than they were prior to the initial surgery. So that's a very invasive procedure. And the last thing patients should be told to do is just learn to live with it. Things will get better on their own. Well, oftentimes they don't get better on their own. So what we offer in our office, what makes our unique position so different, what makes us so unique in how we treat, is we cover this with multiple avenues. The first thing we use is a process called non-surgical spinal decompression. Non-surgical spinal decompression is a machine that we use that helps to gently open up these areas of compression. In fact, the research says it has an 86% success rate with herniated discs. Again, this is a machine that basically distracts and relaxes and allows that pumping of the disc material to become back contained again. And then this is also from the Journal of Neuroscience Research. We thus submit that decompression therapy should be considered first before the patient undergoes a surgical procedure which permanently alters the anatomy and function of the affected spinal joint. So again, this is in the literature that this is a non-surgical procedure that should be considered first. But many of you out there haven't heard of this. The other thing we utilize in our office is what's called Class 4 high-powered laser. This is not a cold laser. Cold laser you do not feel. This is a Class 4 high-powered laser that penetrates the tissues and does many things. Amongst those is it dampens inflammation, decreases interleukin-6, TNF-alpha, increases blood flow to the area, helps to improve faster healing, getting you better faster. Okay? This has been a very instrumental part of our protocol in here in helping patients improve. We've also recently added what's called a PEMF PER2000 device. PEMF stands for Pulsed Electromagnetic Frequency. Pulsed electromagnetic frequency is a device that, again, increases blood flow to the area, decreases pain. Once we can get those things dampened down, then we can start the next process. The device we use, you can look this up online, PER2000. It's utilized by many professional sports teams and athletes, NFL, NBA, MLB, because it helps them get better faster. Soft tissue injuries, they use it for knee problems, different ligament, tendon problems. Once we get those pain levels down to manageable through these non-surgical devices, then we can start putting a plan of attack together for you to rehab this area and get it going in the right direction. So once those pain levels are down, then it makes sense that, hey, we can start strengthening some things, because bottom line is, if we don't correct the functional deficits, we're never going to get where we need to be. So if you're looking for a non-surgical conservative option, then this might be the right place for you. Thanks for your time.